we're going to talk about the thigh region on the first plastinated model. Okay, this is the left thigh. So it is divided into three facial compartments: anterior, all of that, the anterior facial compartment, the medial facial compartment, and then the posterior facial compartments. Okay. Alright, so now let's talk about the anterior facial compartment of the thigh. We've got 5 muscles. This is sartorius. This is quadriceps femoris. It has got 4 heads. Rectus femoris. So if there's a spot on this, we'd say that this is the rectus femoris head of the quadriceps femoris muscle. Vastus lateralis. Vastus lateralis is beneath the iliotibial tract. So this is the iliotibial tract. Tensor fascia lata is from the gluteal region. And again from here, we can see the vastus lateralis muscle. All of that. Vastus lateralis. Beneath the iliotibial tract. Rectus femoris, vastus lateralis, vastus medialis, and beneath the rectus femoris we've got vastus intermedius. Okay, vastus intermedius. You can see that better from here. This is vastus intermedius. And again, this is the vastus lateralis. See? Okay, vastus lateralis, vastus intermedius, vastus medialis. The 4 heads of the quadriceps femoris, rectus femoris, vastus intermedius, lateralis and medialis, they all form one tendon. This is the quadriceps femoris tendon. Quadriceps femoris tendon. This is the patella, and then the tendon continues as the ligamentum patellae. So this is ligamentum patellae, and then it attaches to the tibial tuberosity, or the tubercle of tibia. Okay. From here, it is important to know this relation. On the upper medial part of the shaft of the tibia, we've got insertion of 3 muscles, like this. This, and this. The first one is sartorius, see? Sartorius. Okay. This one is gracilis, see? This is gracilis. It has been cut, okay? It goes down to here, gracilis. And the third one is semitendinosus. This is tendon of the semitendinosus, okay? And this semitendinosus itself. Semimembranosus goes shorter to the medial condyle of the tibia. Okay. So now let's go back to the muscles of the anterior facial compartment. We've got iliopsoas. Iliopsoas. This is iliacus. This is psoas major. If the spot is on this, we'd say that this is the iliopsoas. And from here, this is the iliac fossa. So this large flat muscle is the iliacus muscle. Iliacus. This could be the psoas major, but it's not obvious here. Iliacus. And finally, we've got pectineus from the anterior compartment. Pectineus. So, sartorius, rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, iliopsoas, iliacus, psoas major, pectineus. This was about the muscles of the anterior compartment, and about the nerve supply. It is through the femoral nerve. We can see that here. So all of the muscles are supplied through the femoral nerve, except the psoas major, which is supplied by the lumbar plexus. Alright, and of course blood supply is through the femoral artery, which we can see that here. Okay, so now let's go to the medial compartment. The muscles, we've got gracilis, 3 adductor muscles, the adductor longus. Beneath is the adductor brevis, which is smaller, adductor brevis. And beneath is the adductor magnus, which is the largest one, adductor magnus. Adductor longus, adductor brevis, adductor magnus. This is the adductor portion of the adductor magnus. So only the adductor portion is regarded as part of the medial compartment. This is hamstring portion of the adductor magnus, which is regarded as part of the posterior facial compartment. And this is the adductor hiatus. Adductor hiatus for passage of the femoral vessels. Okay, so this is about the muscles, and we do also have the obturator externus, which we can see that here. Of course, the nerve supply is through the obturator nerve. We can see that here. Well, actually we can. So let's take a look. The obturator nerve comes down here and divides into 2 divisions. Okay, this is the anterior division between the adductor longus and adductor brevis is the anterior division of the obturator nerve. Anterior division. And between the adductor brevis and adductor magnus muscles, we've got the posterior division. See? If you can focus. This is the posterior division of the obturator nerve. Alright, so these muscles are supplied through the obturator nerve, and it's important to talk about the nerve supply of the adductor magnus. The adductor portion of the adductor magnus is supplied through the posterior division of the obturator nerve. However, the hamstring portion is supplied through the tibial portion of the sciatic nerve, because it's on the posterior compartment. Okay, all right, and of course the blood supply is through the obturator artery and the profunda femoris artery, which you can see that here. Okay, so now let's go to the posterior compartment. All right, the muscles we have laterally is the biceps femoris. So this is long head of the biceps femoris and short head of the biceps femoris. So the long head of the biceps femoris arises from the ischial tuberosity. See, this is the ischial tuberosity. It is the part of the body on which we sit. Ischial tuberosity. And this can be the sacrotuberous ligaments. Okay, sacrotuberous ligaments. It's not very clear though. All right, and the short head of the biceps femoris arises mainly from the linea aspera of the femur. Okay, and together they form the biceps femoris tendon. Biceps femoris tendon, which is then attached to the head of the fibula. Okay, and medially we've got 2 muscles, semitendinosus. Semitendinosus lies above the semimembranosus. So semimembranosus is larger and is beneath the semitendinosus. Okay, the semitendinosus has got a long tendon which attaches to here, as we talked about earlier. The semimembranosus is larger. Okay, it has got a shorter tendon which attaches to the medial condyle of the tibia. Okay, it goes shorter. All right. It seems that the semitendinosus muscle has arisen together with the biceps femoris. Okay, this is just a way to differentiate between the semitendinosus and semimembranosus. Of course, they again arise from the ischial tuberosity. All right, and as we said, we've got a hamstring portion of the adductor magnus muscle. From here, we can also see the vastus lateralis, as we said, and also the adductor portion of the adductor magnus. See, if we have a look, this is, see, this is all, if you can focus, this is all the adductor portion of the adductor magnus. It's a very large muscle. Okay, adductor portion of the adductor magnus muscle. All right. Of course, this is the sciatic nerve. We've talked about this many times. This is the common peroneal nerve and the tibial nerve. The short head of the biceps femoris is supplied through the common peroneal branch of the sciatic nerve. However, the long head of the biceps femoris, the semitendinosus, semimembranosus, and also the hamstring portion of the adductor magnus are all supplied through the tibial portion of the sciatic nerve. This is the adductor triangle. Boundaries superiorly is the inguinal ligaments. Laterally is the sartorius. Medially is the adductor longus. The roof is skin and fascia of the thigh. The floor is iliopsoas, pectineus, and also adductor longus. Okay, so today we're going to talk about the leg, the facial compartments of the leg. This is the left leg on the first plastinated model. Okay, so this is tibia. Okay, this is shin of tibia because it's medial, and laterally we've got fibula. Okay, so about the muscles of the anterior facial compartment, this is tibialis anterior, and this is its tendon of the tibialis anterior. Okay, and now before continuing the muscles, let's talk about the retinacula of the ankle. This is the superior extensor retinaculum. Okay, all of that. Superior extensor retinaculum. Okay, superior extensor retinaculum. And this is the Y-shaped inferior extensor retinaculum. And from here we've got the inferior peroneal retinaculum. Inferior peroneal retinaculum laterally. Okay, and medially, from the medial malleolus to the medial surface of the calcaneum, we've got the flexor retinaculum, and this is also continuation of the flexor retinaculum. Okay, flexor retinaculum. And the superior peroneal retinaculum has been removed. It goes from the lateral malleolus to the lateral surface of the calcaneum, but it has been removed. Okay, now back to the muscles. We said that this is the tibialis anterior and its tendon. this large muscle is the extensor digitorum longus, okay? All the way from here, extensor digitorum longus, okay? Extensor digitorum longus, and again, this is the like that. This is all the extensor digitorum longus, and these are its tendons. 1, 2, 3, 4. 1, 2, 3, 4. Or actually, we should say like this, you know, first, second, third, fourth tendons to the lateral four toes. Okay, these are tendons of the extensor digitorum longus. And here in between is the extensor hallucis longus. See, this is the extensor hallucis longus, like this. If there's a spot on this, we'd say that this is the extensor hallucis longus. And from here, this could be the extensor hallucis longus. Okay, kind of. It's not very clear, but this could be the extensor hallucis longus. And this is its tendon. Okay, this is, see, this is tendon of the extensor hallucis longus. That's it. This is it, and this is tendon. Okay, and we also have peroneus tertius, but we can't see that here. And this is the extensor digitorum brevis. See, this large flat muscle is the extensor digitorum brevis, arising from the calcaneum, and it has got 4 tendons into the big toe, second, third, and fourth toes. See, here are the tendons. This is tendon to the big toe. See, so this is tendon of the extensor digitorum brevis that goes to the big toe. This is tendon of the extensor hallucis longus. Okay, the other tendons of the extensor digitorum brevis. This is the second tendon. See, the second tendon that goes to the second toe. This is the third and the fourth tendons to the third and fourth toes. Okay, and that should be it about the anterior compartment. Now let's move to the lateral compartment. So this is lateral compartment of the leg. We've got 2 muscles, the peroneus longus and brevis. Okay, so this is the peroneus longus, all of that. See, this is all the the peroneus longus. Okay, see, peroneus longus, like that. Okay, and this is tendon. See, it's got a very large, long tendon, like that. This is tendon. See, this is tendon of the peroneus longus. Okay, tendon of the peroneus longus, and from here, again, we can follow that. It goes into here. Okay, so this is tendon of the peroneus longus. It goes from lateral back to the medial. Okay, but this is tendon of the peroneus brevis. It attaches to the base of the 5th metatarsal bone right away. Okay, so it will not go back to the medial, but the tendon of the peroneus longus will go to the medial. Okay, so from here, this is the peroneus brevis. Right beneath the peroneus longus, we've got peroneus brevis. See, this is all the peroneus brevis. See, it starts from here. See, this is the peroneus brevis. Okay, and see again from here, this is the peroneus brevis. Peroneus brevis. See, so this peroneus brevis. Again, this is peroneus brevis. That's that, peroneus longus. And the tendons, see, this is tendon of the peroneus longus and peroneus brevis. And peroneus longus and peroneus brevis. Okay, and now let's go to the posterior compartment of the leg. in the posterior compartment, we've got the superficial and deep group of muscles. The superficial, this is the gastrocnemius. This is medial head and lateral head of the gastrocnemius. Okay. This is the Achilles tendon or the tendocalcaneus. It continues into here. So again, it attaches to the posterior surface of the calcaneum. Okay, so this is the tendocalcaneus or the Achilles tendon. Again, this is the tendon, the Achilles tendon or tendocalcaneus. So the gastrocnemius and soleus muscles have the same tendon, which is the Achilles tendon. So again, medial and lateral heads of the gastrocnemius and the soleus muscle. This large muscle is the soleus muscle. Okay, so see, this is the soleus muscle. All of that beneath the gastrocnemius is the soleus. Okay, the soleus muscle. All right, the plantaris, we can't see that here, and also the other deep muscles, the popliteus. We can't see that here, but we can see the other posterior, the other deep muscles. Okay, so gastrocnemius, soleus, plantaris, and popliteus, we can't see them, but the others we can. So let's check those out. See, this was the lateral compartment, the peroneus brevis and peroneus longus. This is the deep muscles of the posterior compartment. So this large one is the flexor hallucis longus. See, this is flexor hallucis longus. Actually, let's begin from medial. Okay, so this is the flexor digitorum longus. See, all of that. It begins from here, this muscle. Okay, this is all the flexor digitorum longus, and this is these are its tendons. Okay, tendons of the flexor digitorum longus, and this is tendon of the tibialis posterior. Okay, and this is tibialis posterior. We can't see that very clearly here, but this is it. Okay. This is beneath the flexor digitorum longus is the tibialis posterior. This is tibialis posterior, and this is its tendon. So the most medial tendon beneath the flexor retinaculum is the tendon of the tibialis posterior, and then we've got tendons of the flexor digitorum longus, and then we've got the tibial nerve. See, this is the tibial nerve, and again, this is the tibial nerve. We can see the division of the tibial nerve. It divides into two terminal branches, the medial and lateral plantar nerves. Medial and lateral plantar nerves. Okay, and this is the flexor hallucis longus, as we said, and this is its tendon of the flexor hallucis longus. Tibialis posterior, flexor digitorum longus, tibial nerve, medial and lateral plantar nerves, and flexor hallucis longus. All right, and that should be all about the muscles of all the compartments. And now about the nerves. This is the sciatic nerve on the posterior compartment of the thigh. It divides into two branches, medially the tibial nerve, laterally the common peroneal nerve. This is the common peroneal nerve, tibial nerve, and this is a cutaneous branch of the tibial nerve, which is called the sural nerve. The sural nerve goes between the two heads of the gastrocnemius muscle. Okay, and this is just a muscular branch of the tibial nerve. Okay, the tibial nerve, of course, goes down into here again. As we said, this is the tibial nerve.